Hey everyone, good morning. Hope everyone's doing swell. We all feeling good and great, preparing for our finals. Yeah, woo! Anyways, before we could get to that stuff, y'all are gonna listen to me and my team ramble on about something we're all gonna be messing with in our clinical sites: trachs. All right, cut it out. First things first, what are trachs? Well, we just went over it 2 weeks ago. Go look at your notes. Before we can talk about the different types of trachs, we first need to know what a tracheostomy is. A tracheostomy is a surgically created opening in the neck into the trachea, typically between the second and third tracheal rings. This opening, or stoma, has a trach tube inserted to allow a patient to breathe. So, now you may ask yourself, why? They can't just breathe through their mouth and nose like everyone else? Good question, Dylan. No. Trachs are for patients that have a blocked airway, cannot breathe independently, or need long term mechanical ventilation due to things like cancers, trauma, and other illnesses or complications. So, that brings us to our indications.
Well, that's not that simple.
So, the first main indication is to maintain a secure airway. Like we said before, these people most likely can't breathe on their own because of some kind of anatomical or physiological problem. We're bypassing that problem through their throat. Other indications would be facilitating suctioning, preventing aspirations, sealing the airway for mechanical ventilation or CPAP. This also makes intubation possible for some patients that previously weren't able because of something like a spinal cord injury or trauma. Lastly, long term mechanical ventilation. I have another question. No clue how that guy keeps getting on here, but moving on. Y'all are probably sick of me by now, so I'm gonna pass it to my good friend Ashley to tell you about the contraindications.
Hi everyone, I'm Ashley, and today I will be telling you about the contraindications of trachs. Now, there are no absolute contraindications to tracheostomy, but several relative ones, meaning nothing is completely stopping you from doing or putting in a trach. They're more like precautions. This includes bleeding disorders, cervical spine stability, abdominal neck anatomy, high oxygen or PEEP requirements, obesity, and hemodynamic stability. These factors increase risk and require careful assessments before procedures. I should also mention the risk of having a trach in can cause infections and glammunomas. These often develop from constant irritation, foreign body reactions, and microbial colonizations of the stomach.
Okay, and we're back. Thank you, Ashley, for all that lovely information. With all that out of the way, we could get down to the nitty gritty. Take it away, y'all. Show them the trachs.
Hi everyone, my name is Ashley, and today I will be telling you about the Shaley tracheostomy tubes, which are available in cuffed or uncuffed, fenestrated or unfenestrated, and in standard or extra long lengths. Most commonly used for patients requiring medical ventilation. Some features have disposable inner cannulas for short-term use. And one key to always remember is that all inner cannulas must be in place to allow ventilation.
Okay, so here we also have another Shiley trach, right? This difference is that this one is cuffed. It has a little balloon at the end, so you would inflate it like so. Right? See how it inflates there, like a little balloon. Okay, the purpose of the cuff is to actually seal off the airway, so you can actually administer the mechanical ventilation, and it doesn't allow any aspiration. Nothing can come down, no type of secretions go down into the airway. This one is a Shiley, like I mentioned, so the inner cannula is actually disposable. Okay, you take that out and just swap it for a new one when you need to. Over here we have a similar one. It's going to be cuffed also, but this one's a Portex. So this would be for long term. They wouldn't put this trach in initially. This would be something that they would put in afterwards, so they can go home. You can live lifetime with this one. The flange is more flexible. It's clear. The difference on this one is that the inner cannula is usually not disposable, so you got to take these out, clean it, all right, and reuse it. They're color coded too for the different sizes. Both of these can come uncuffed, cuffed, fenestrated, non-fenestrated, whatever the patient needs. Here we actually have Passimir valves, or a talking valve, right? You will go ahead and put this at the tip of the trach like that, and this allows the patient to be able to speak. It allows air to go in but not out, so that the air can go up through their airway, through their vocal cords. This one is a Shiley. Same thing. This one just has a little port that you can actually connect O2 to it if you needed to.
And that's pretty much it, y'all. I hope you don't feel like this was a complete waste of your time. Knowing how trachs work is very important for our job as future RTs. You're going to be changing them out and cleaning them throughout your career as well as the next semester, so get ready. Thank you to the team for working hard on this project, as well as Dylan for guest starring in everyone's project. And thank you all for listening. Have a good one.